want to
No, he wants them to start. Everybody to be on the title. Okay, it's already now. Saka. Yes, yes. Let's start. A very warm good morning to everyone here present. Today, it is a pleasure to have you around. And to start this auspicious occasion, we will start by the national anthem. Thank you, everyone. Today, we have all gathered here to celebrate NACA and facilitate with NACA in the presentation of the stewardship over the years since the inception of NACA. From the year 2007, where the bill was assented to by Mr. President, and we became an established agency till 2021. It gives me great pleasure to observe all protocols. The Secretary to the Government of the Federation of Nigeria, Mr. Boss Gida Mustafa, who is joining us virtually. The Chairman, NACAP Governing Board, Senator Oladipo Odujiri, is also virtual. We have also with us Dr. Sonny Aliyu, who is also joining virtual. We have before us the DG NCDC, who is also virtual. We have the CFO, NHIS, it's also virtual. Deputy Community Director, PEFA Nigeria, we welcome you. Professor Ladipo, we also acknowledge your presence. Dr. Kalada Green Ulomi, we acknowledge your presence. Professor Nasiru Sambo, Dr. Mofi Ukopo, the Director General, Mr. Kalada Green, Country Rep, University of Manitoba, all SACA's DGs, Executive Secretaries and Project Managers here present, IGR Memunat, former Director, Partnership Coordination of NACA, Dr. Ibrahim Acha, former Director of Special Duties, Dr. Kayode Ogunbemi, former Director of Policy and Planning, the National Coordinator, NEP1, Ms. ASWAN Coordinator, Mrs. Assumpta Regina, Ms. Amber Itoa, Minerala Coordinator, Mr. Emeka FCT Faka, all NACA former directors, my Director General, Dr. Gambo Aliyu, management and staff of the agency. We welcome you once again. On this note, at this junction, we will call the opening remarks by the board chairman, Senator, distinguished Senator Oladipo. Permit me to specially welcome Dr. Eramos Mora, the UNAIDS Country Director. You're welcome, sir. In the same vein, we'll call the chairman of the governing board, Dr. Senator Dipo Odujiri, for his opening remarks.
Good morning. Am I being heard loud and clear? I stand on the existing protocol, and I welcome you to the first NACA Day celebration. And I want to congratulate the management of NACA for the good job that is being done. We remember our founding fathers and the past chairmen of boards and the past DGs of board of NACA for the foundation which they have laid so well and for which we are very proud. I want to encourage the DG of NACA and management and staff to keep up the good works and to make NACA #1 agency in the prevention and eradication of HIV and AIDS in Nigeria. Thank you very much. Welcome and good morning.
A round of applause for the chairman, Senator Oladipo Odujiri. Next on the program today, this morning, we will take goodwill messages from our partners, our stakeholders, and also members that are here present and also virtually. The first to take the goodwill message will be Dr. Erasmus Mora, the UNAIDS Country Director. Sir. Should I come there?
Yes. Good morning, people. Good morning, colleagues, and all protocols observed. DG Gamble, my brother, it's such a wonderful day. I was thinking at age of 14, that means Naka is a teenager. Yeah? The beauty of life is to be a teenager. A teenager has their minds completely freed. Yeah? They don't think death ever happens. They don't think bad things ever happen. It's just an exciting period to be alive. So Naka, you're in the best period of your life as a teenager. UNAIDS is almost, I would say, a sister or brother organization to NACA. The way we are in the UN family is the way NACA is. So to be here to acknowledge your 13th birthday is of immense gratitude for the UN system. UNAIDS is made up of 11 UN agencies that came together so that when we support countries, we don't confuse countries, but we actually support them in a consistent and in a complementary manner. Greetings from the United Nations resident representative to Nigeria, Mr. Edward Kalon. Greetings from all the UN agencies that we represent. WHO should be here, UNDP, UNICEF, UNFPA, ILO, you name all of them. I bring greetings and I want to appreciate NACA for this particular day. I just rushed out of a meeting with my colleagues and I asked all of them, please tell me what is the most important thing that comes to mind when you think of NACA at 14 years of age? Dr. Gambo, they say that NACA represents the face of the response for HIV in Nigeria. It's undisputed. The face of the response of HIV in Nigeria is what NACA represents. They say to me that NACA provides very clear national leadership on strategic issues concerning HIV. And the word here is strategic, not on all the issues, but all the strategic issues. And they say to me that NACA has been effective in the decentralization and ownership of the response at the state level. So you didn't just keep it at the federal level, you made sure it permeated across Nigeria. But they say, as NACA is turning 14, NACA should now watch out for two things: complacency and sustainability of the response, because people start to get tired, yeah? And they feel that this is a very important period for NACA to be reflective and for NACA to ensure that it thinks about the future. So, my dear brother Gambo, I want to leave you with 4 thoughts about the future of NACA. I'm now going to talk about the fact that Nigeria, for the first time, actually is in sight of achieving 90-90-90, things that were of dreams, but it's actually going to happen. And I feel blessed to be in Nigeria that this is happening now. But going forward, NACA, please keep in mind this. My dear brother Gambo, your business is to ensure that the vision for the HIV response is well understood and articulated. Your first business and your first mission is to ensure that there is a clear vision for the HIV response. The second, my dear brother, Dr. Gambo, is 4 things will keep you alive and keep you relevant. One is partnerships, networks, people living with HIV, key population, and civil society. The minute these things start to elude you or become distant from you, my dear brother, know that the end is coming, not in a very positive way. Networks of people living with HIV, civil society, KPs, and partnerships. Keep your eye always on the opportunities. The opportunity that is on ground now is COVID. How is NACA engaging on COVID? The opportunity that is going to remain after you achieve 95, 95, 95, Dr. Gambo, will be prevention. How is it that NACA is championing prevention? And lastly, my dear brother Gambo, please, no matter what you do, chase ideas. Money always follows ideas. Chase ideas. If you must chase money, Dr. Gambo, don't chase it for yourself, chase it for others. The danger will be a NACA that now starts chasing money for itself. And lastly, as much as you may want to do it, resist doing things yourself. NACA exists to make sure the right things are done. Not that you do them yourselves. The minute you start doing them yourself, you will know that you are not any longer in the spirit of NACA. NACA exists to ensure that the vision is there, partnerships are mobilized, people living with HIV, key populations are at the center, and more importantly, that you raise money for others to do what they're supposed to do, and you hold them accountable. So please resist chasing money for yourself and to do things, and keep your eyes in the future. This teenager has a long life to live. So thank you very much. It's a pleasure for the United Nations to be here. Thank you, Dr. Gambo.
A round of applause for Dr. Mora, please. We will stick to the words of advice you have advised us. And one key thing that I held on to while you were speaking is chase ideas. Money will follow ideas. And I also know that the Director General has noted the words of advice. And I know also with all supporting him, NACA will achieve greater heights than before. In the same vein, we will call upon the CCM Executive Secretary, Mr. Dozie Ezechiku. Is he here? Yeah, please. I will, at this junction, with directive that we spend 1 minute each for the goodwill messages. Thank you.
Yeah, thank you very much. I'm not quite sure I'll be very objective given my history, but I'll do my best just to stay on the issues. And thanks, Dr. Rasmus, for that insight. You sounded as if you were here when it all began, and then we got to this point. So just to build on what you've just said, from the group fund perspective and CCM perspective, I think I will stick to what we have benefited as a country because we have NACA in place. And what rightly comes to mind almost immediately is direction. Okay, direction. When this whole thing started, if not for the policy, National HIV policy, National HIV strategic framework first, and then the plan, people will probably be drawing money from different sources all over the world, doing whatever they like in the corner of their rooms. But with that vision, from NACA leadership, it set the tone for what should be done, how it should be done, by who, at what level, and what results, more importantly, what result do we expect to see? And NACA was very, very strategic in ensuring that they closely monitor followed every money that was brought in. If they had to be at the table, they have to be at the table to make decision who gets the money, how it's spent, and what result we intend to achieve. And if not for that, probably we wouldn't be talking about being a step away from 1990, as you just mentioned today. So I think we need to applaud NACA for that. And also, very importantly, you can't do anything without capacity. I think one of the key benefits we've gained from NACA as a country with regards to response, even beyond HIV response, health system strengthening, is capacity that NACA has institutionalized all over the country. Name it, every organization, every agency, every institution at national level, subnational level, you would, if you don't see what NACA did by putting it up, you will see NACA's descendants, running those places, ensuring that the right things are done. So I think NACA should keep this on track, because with that capacity, you can't really achieve anything. No matter how much money you have, you can spend all the money without results. So we need to strengthen that. And as it matures from teenager to adolescent, we expect to see even higher strategic engagement beyond, national, but also regional level, to ensure that this capacity is also permeating all the nooks and crannies of the country and beyond the borders of this country. Because with HIV, if you don't manage what's happening around your borders, it may actually retard your progress towards the set direction. So on that note, I want to appreciate NACA once again and commit that from CCM perspective, we will constantly and regularly partner with NACA beyond what we are doing at the moment, to also include other areas that will come up, as we move forward. Thank you, and God bless.
A round of applause for Mr. Jose, please. Before I move to the next goodwill message, I will recognize the presence of the Honorable Committee Chairperson on ATM, Mr. Dairi Sarki. You're welcome, sir. Also joining us online, we have Mr. Jerome Mafeni, former CCM Chairperson. Also, we have the former Permanent Secretary, Mr. Shegun Adekunle. We also have joining us today, Mr. Jeku Ozuemene, the CEO, HIV Trust Fund. We also have joining us online, the representative of NASCAP, Dr. Debbie Odo. We also have Dr. Adiza Kwamafo for FHI 360. Thank you for coming. We recognize your presence this morning. The next goodwill message will be said by NEP1 coordinator represented, Mr. Aliu. Oh, madam. Oh, okay. So, Mr. Aliu, the coordinator, please take your goodwill message. 1 minute, please.
Yeah, no.
While we're waiting to set up the to connect, we will take the next person, who Miss Professor Oladipo. Okay.
The host is not allowing.
Kindly unmute him.
Hello.
Yes, you're muted now.
We can hear you, sir. Please go ahead.
Good morning, distinguished ladies and gentlemen. In 1 minute, let me just congratulate the Director General of NACA, the highly technical staff, and board members who have made it possible for NACA to have accomplished enormous feats in the last 15 years or so. Today, HIV is like any other chronic disease. And all of this is due to the collective efforts of NACA, the leadership of NACA, providing leadership in policy direction, capacity building, and also strategically positioning different dramatics personnel to ensure not only prevention programs, but also treatment programs. I think today we also need to appreciate our government, the federal government of Nigeria that has been responsive, and also the donors, in particular our partners, UNAID, USAID, who have supported the nation. I want to wish you well, and I hope in going forward, we'll take advantage of the current COVID problem and see how we can draw some lessons from what you have done in the past to guide the nation. I also hope that we will not lose sight of pregnant mothers who may be positive, to ensure that they all have access to preventive therapies that will ensure that their babies are born without being infected. Once again, congratulations.
A round of applause for Professor Oladipo. We'll reinvite the NEPA National Coordinator. Please check. Okay, it's not online. Then, okay, while we wait for him, we'll come back to him. We'll call on the Managing Director, Society for Family Health, to give his Godwin message. 1 minute, sir.
Just permit me to stand on existing protocol, just to join my voice in bringing goodwill from the board staff of the Society for Family Health, and to congratulate NACA for such a wonderful day. I know they are saying 14, but for some of us, it's a very personal experience and something to celebrate. Dr. Gambo, I will even say you are 20 this year, because actually the battle started this time 20 years ago. And I think a lot has truly been achieved, as we can see in our sort of journey towards achieving the 1990 targets. Just to say, as an implementing partner, we've truly enjoyed the leadership, the policy direction that NACA provided over the years, particularly the ability to keep scaling, so that even at the different stage of the epidemic, we have a body that has truly responded to the peculiar needs of civil society and implementing partners. So for this, I congratulate you. I think just to say, we are truly excited. This is just 14 years, and we look forward to the years ahead, even as we continue to count on the very strong leadership of NACA to frame the policy direction that will finally take us to end this epidemic. But more importantly, to sustain the gains we've made. And I can see some really exciting discussions already in place. So congratulations for the journey so far, for the great success recorded, and to say we are truly proud to be associated with NACA. Thank you very much.
Thank you very much, sir. A round of applause for him. Is the NEPA coordinator back online? If it's not, we'll kindly take Dr. Sani Aliyu, Past Director General.
Hello, good morning, colleagues. Good morning, SGF. I'd like to start, first of all, by congratulating NACA for the progress you've made over the years. But before I do that, I just wanted to, first of all, highlight the issue of leadership and the importance of having strong leadership. In particular, the SGF has been extremely supportive when it comes to agencies under his care. And this includes NACA, as you can see from this morning, where he was on before most of us even logged on. And we would like to thank the SGF, his supervising staff, and all those that have been supporting NACA over the years. Congratulations, 14. It's a good age. NACA is still a relatively new agency compared to other agencies of government. But what is very clear is that NACA continues to really be small but mighty. And what we know is that the NACA model works. NACA as a government agency has been one of the few agencies that are on track to achieve their mandate. And even from the perspective of what is going on now with COVID, a lot of you would probably identify that some of the things that we have been doing at the PTF, for instance, very much reflects what NACA has been doing over the years in terms of the multisectoral nature of the response and in terms of the coordination. So NACA should be proud of what they've achieved, or what we've achieved, I would say, both in terms of the skills built, in terms of the staff trained, and in terms of the lives saved over the years. But it is not over yet. With the advent of COVID, what has become clear is that the challenges for HIV will continue to be very much with us. And other pandemics will continue to come and distract us in a way. But NACA really needs to remain focused. We need to make sure that the leadership continues to push. I am sure the federal government, from the position of the SGF, will continue to support NACA in whatever policy or future direction. But definitely, we need to think about the future. As more and more people come on treatment, as Erasmus said earlier on, prevention will be the key. And we should not forget that HIV is not going to go away suddenly, in the same way that COVID is unlikely to go away suddenly as well. So let us continue to work together. I would continue to urge NACA to strengthen the partnership that it already has, the advantages that it has in terms of the reach with the donor community, in terms of the trust that it has built over the years. But congratulations once again. NACA should be proud of what they've achieved so far, and I hope we will continue to go from strength to strength. Thank you.
Thank you very much, Dr. Sani Aliyu. In the next on the agenda will be the Director General, National Agency for the Control of HIV and AIDS, to come up with his presentation. Dr. Aliyu Gambo, please.
The Secretary to the Government of the Federation, my boss Gida Mustafa Gida, the Chairman, House Committee on HIV, Honorable Sarki Lahiru here with us, the NACA Board Chair, former NACA DGs, Dr. Sani Aliyu, and the National Coordinator for COVID Response, the UNAIDS Country Director, Erasmus Mora, my friend, brother, who has sacrificed some of his tight schedule to be here today. Thank you. The DG, NCDC, the Executive Secretary, National Health Insurance Scheme, head of implementing agencies and our implementing partner, a representative of PEPFAR, colleagues from CDC, USAID, and Global Fund, representative here in Nigeria, represented by CCM. The directors, past directors of NACA, a very good morning. This is supposed to be a 1-hour event. That's why we're rushing, and that's why we may not be able to take goodwill messages from as many people as we have wanted to take. But that said, I'm going to be very brief in my presentation, and this presentation is supposed to capture what NACA was when NACA came to fruition, when NACA was established in 2007, and what was the status of the national response. Then 10 years after, we see how the national response changed, and then the phenomenal changes that have taken place in the last 4 years, for which the entire world is happy with Nigeria. This phenomenal change that has happened is what has brought NACA to the forefront globally, and is what has brought Nigeria to the fore today on HIV. And the last 18 months of this change has been really, really great. And you just follow me on this presentation, and we'll get there and you'll see what I'm talking about. This is where we started. In 2007, we started with a prevalence of about 4.6%, estimated people living with HIV/AIDS of about 3 million. And then we had only 200,000 on treatment. We had only 251 treatment sites, and our prevention curricula and mechanism, was not really fully developed. Then we were using the ABC approach. We were looking at most at-risk population, not the key affected population. Our M&E system was just PEPFAR-based, and there was high level of stigma and discrimination at that time. And LGA coordinating bodies were underdeveloped. And we had some monitoring, and some policy documents were actually in place because it has existed as National Action Committee on AIDS before NACA came to fruition. Next slide. So 10 years later, this is what has happened. The prevalence shrink to about 3.4%. The estimated number of people living with HIV/AIDS was then estimated at about 3.4 million. And then we had made significant progress where we were able to capture up to about 830,000 individuals on our treatment, up from 200,000. So you can see also there was huge growth in terms of our treatment site. We had treatment site of about 1,500 as at 2017, that's 4 years back. Our M&E system has changed, from being paper-based. Now we've developed a national data repository, which is domiciled at Ministry of Health. Our EMR program was up and working at the facility, and we're capturing data on NDR, and our coordinating institutions at state and LGA were fully developed. Next slide. So let me tell you, this is the game changer. This thing happened at 2017 United Nations General Assembly, where Mr. President made a pledge. He made a pledge to support the HIV response, and not only to support HIV response, to support increment in the number of people that are treated under the government of Nigeria's corpus. And this pledge was actualized actually last year, Mr. President on his return. But this energy, this energy led to something. And this is what we're going to see in the next slide. So this is the past 2017 rebasing the epidemic. Given the encouragement NACA has received and the nation HIV structure has received, including our stakeholders, we now look back and see we have had an issue that has been in discussion, but decision has not been taken. So this is the time when that decision was taken. Our national prevalence from several estimates, is not really adding up, and it's not agreeing. It's not agreeing in the sense that if you look at different mechanisms we use to estimate the national prevalence, the NAS 2012, the ANC 2014, the program data 2016, and the spectrum estimate, you see prevalence estimate that are at variance. So this prevalence estimate that are at variance is a source of pain, to HIV stakeholders in this country. And then now the question is, do we really have this much epidemic that is this big? Are we really having our estimate right? Or are our method and manners of making this estimate, short of being fully representative? And that was what led to the changes that follow. But if you look at these states that you can see, if you can recognize some of these states where we have this difference, look at the ANC estimate that was in red, and the spectrum estimate that is in green, and the NAS estimate that is in blue. You can agree with me, you see, if you look at states like Benue, there is huge variance. If you look at states like Anambra, there is huge variance. Some other states all over the country, you can see the variability. So this variability is not looking good because we don't know which one to use, for our programming, for our policy, and for decision making. And the next slide, is what has happened to give us a kind of a direction on this. This is the NICE survey. The NICE survey was very much representative in the sense that we took sample from virtually every LGA, from a sample of cluster sampling using enumeration areas. So there was representation from virtually every local government in Nigeria, and it was a household-based survey, and it was in addition to behavioral biological. What happened? At the end of it, we now come to realize that we don't have an epidemic as big as we thought in the past. That number that we're thinking 3.4%, 1.3%, the people living with HIV/AIDS that we are thinking to be around 3.4 million are now estimated at 1.8 million. And the discrepancies that we have in states, especially those states that are highlighted here, has disappeared. Look at it carefully. Look at the spectrum estimate 2016 and look at the NICE estimate. Look at those states that were earmarked in the red here. You agree with me that there is huge difference between the NICE estimate and the spectrum estimate. But when you see the NICE estimate across the state, you will see an estimate that is very reflective of the situation that is happening at those states. So these are the game changers, that has triggered energy, that has triggered a lot of changes that follow in the national HIV response. Next slide. So this is what has happened. If you look here carefully, you will see between 2007 and 2017, we have added net on treatment about 625,000 people. But if you look at what was added in the last 4 years in this administration, between 2017 to 2020, we have added almost the same number we have added 10 years before that time. So this is what that thing. So this is the game change. And this is what the energy the NICE brought about. This is what the energy, the political commitment, and the leadership we have had in this administration has brought to bear, on HIV. Apart from that, we've come together. All HIV stakeholders in the nation have now converged, and now we're doing what we are calling alignment. And this alignment is to have one HIV national response, where we bring everybody under one roof, and every program, complementing each other. And we have, in that alignment, we have PEPFAR, we have the government of Nigeria, and then we have the Global Fund. So now we talk of the national response. We don't talk about PEPFAR program, Global Fund program, or NACA program. No, we talk about national response. And I think this is what Erasmus was alluding, what NACA should be doing. NACA should be coordinated. This is exactly what NACA is doing now. We are coordinating and we are looking at the national response. our data, you know, are now most reliable in terms of what we are capturing, in terms of what we are sharing, in terms of what our implementing partners and the stakeholders are using to inform decision, and in terms of what we are relying also to inform our decision. Next slide. So this is the point Erasmus was making. Growth in KP. How have we fared? Let me tell you, this epidemic in Nigeria is dual. There is one in general population that is declining rapidly, but there is another one that is raging rapidly. This is the epidemic among the key affected population. If you look at in 2017, we had only 16,000 of them on treatment. And if you go back to 2007, when we started, we had only 1,000 of this population on treatment. Now look at what happened now in 2020. We have almost 150,000 of key affected population on treatment, and the sites where we give them these services, one-stop shop, we call them, have increased astronomically from 10 in 2017, 0 in 2007, 10 in 2017, and 60 in 2020 as of December 2020. We are not done yet. Next slide. So this is the thing that is capturing the attention of the world on Nigeria. You know, COVID has struck when we were least expecting and when we were not ready. So when COVID struck, look at March, and look at April, and look at May, you know, Nigeria was down in terms of the number we are capturing, in terms of the number we are getting to place on treatment. But look at the jump just after May. What happened in June, what happened in July, what happened in August in Nigeria has never happened in any country in the world. Nigeria rebound, and Nigeria rebound very strong. And because of that, you know, Nigeria is being recognized among 6 countries, you can see them, that have survived the COVID impact. But Nigeria has set history. Nigeria has set history in the sense that there is no country in the world in the 17 years of paper programming that have grew within the last 18 months and within the last 1 year like Nigeria. There is no country that has ever added close to 300,000 people in 1 year. Nigeria has added Nigeria has added in the last 18 months about 400,000 on treatment, and about 100,000 of these 400,000 are key affected population. Next slide. This slide didn't come from me. I didn't make this slide. This slide is from United States government. What this slide says is that among all PEPFAR supported countries in the world, Nigeria has the greatest yield in the last fiscal year between September 2019 to October 2020. And this makes Nigeria the highest country, country with highest net new in PEPFAR history. And this is what is capturing the attention of the world. Despite COVID, despite the upset we have from COVID, Nigeria has rebounded, and Nigeria has rebounded strong, and Nigerian HIV is now leading the world. Nigerian HIV response is now leading the world and giving the world confidence that Nigeria is on track to control this epidemic earlier than expected. Next. Now the future. To control this epidemic and to sustain this epidemic, we must keep the current momentum going. We must not lift our foot off the pedal, because doing that will be disastrous for Nigeria and will be disastrous for the world. We must keep the current funding until we control this epidemic. We must keep the science that is informing our decision, and we must keep the communities, the network of people living with HIV/AIDS, the key affected population, and the communities that are out there helping us and going to all the nook and crannies of this country and bringing out people living with HIV/AIDS and registering them and bringing them to treatment. We must keep that. In terms of sustainability, we must figure out ways to increase domestic investment, both public and private. I'm happy that the CEO of HIV Trust Fund is on, And the HIV Trust Fund has now come to fruition, even though we are yet to launch it, but it's a good step forward. We are looking forward to state ownership, and not only ownership, we are looking forward to formal contribution by the state, a chunk that will be HIV counter funding by the state. This is real critical, going forward in our ability to sustain this epidemic when we eventually get to control it. Local manufacturing of commodities is very essential. We must figure out ways to manufacture locally so that disruption, price disparities, will be eliminated. Because right now, even with your money, you can't get this drug. If you place order, it will take you 6 months before you get them. Ladies and gentlemen, I wish to take this opportunity to thank you for listening and to thank you for all the support you have given NACA all these years. Thank you so much.
Fantastic. A round of applause again for Dr. Ali Gambo. With the take home under his leadership, he had set commitment and leadership over the years, national response and coordination. Nigeria has set the history, the record, in terms of adding more people to the HIV treatment. Nigeria has the greatest yield, and PEPFAR in history at giving account that Nigeria has responded so well. We couldn't have done this without the political commitment and leadership. A round of applause again for Dr. Ali Gambo. Because of our time, we move swiftly to the remarks by the Secretary to the government of the Federation in person of Mr. Boss Gida Mustafa. Sir.
Thank you. I hope you can hear me well.
Very well, sir. Please go ahead, sir.
Thank you. The Chairman House Committee on HIV, AIDS, and Dr. Erastus Mora, and other development partners, Chairman and Board of NACA, the Director General, Dr. Gambo Aliu, and other management staff of NACA, Dr. Sani Aliu, former DG NACA, and other DGs. I can see NCDC there and other heads of MDS, other partners in the fight against HIV AIDS. Distinguished ladies and gentlemen, good morning. I am pleased to congratulate the board and management for the insightful initiative taken to inaugurate a NACA Day. The inauguration and the celebration of the day when this agency was founded is certainly an occasion for much historic and collective reminiscence of how the HIV epidemic created a terrible burden for millions of individuals, families, and communities around us and the world. At the time NACA was inaugurated as an agency on this day in 2007, the challenges that confronted the agency were the burden of HIV-related stigma, deficiency of the disease knowledge by most health workers, lack of access to treatment, absence of vigorous prevention efforts, dearth of effective social outreach and support for those vulnerable. Due to the efforts of past and present leadership of the agency, most of these challenges have been surmounted. Ladies and gentlemen, in the last 14 years, I make bold to say that this agency has achieved so much in its mission to the admiration of government and partners. Just in 2018, NACA led the Nigeria HIV/AIDS Indicator and Impact Survey (NICE). This was a national household-based survey that assessed the prevalence of human immunodeficiency virus, HIV, and related health indicators. The time frame for execution / recorded successes of the survey has been rated as best to none. With the onset of COVID-19, the NACA model has worked well in demonstrating resilience and mitigating its impact on the country. Through very strategic and favorable policies of government, millions of people now have access to ARVs, and global targets for prevention, testing, and treatment are being met. The present government of President Muhammadu Buhari has continued to make resources available through NACA to sustain this momentum. This includes the commitment to have additional 50,000 Nigerians placed on treatment each year, feat no past government in this country has achieved. Be assured that government will continue to do more, as it has faith in the diligent commitment, accountability, and transparency of the management in the agency. The Director General and other management staff, I look forward to your continued leadership as you guide NACA through the next phase of history. I wish NACA's board, management, and staff more unwavering successes and personal fulfillment in the roles they play in this agency. You have made all of us proud. May God guide you in all your decisions as together fulfill our mission and vision of NACA. Once again, I congratulate you all for conceiving this idea of NACA's founding day. Thank you, and God bless you. Have a wonderful day. Thank you.
A round of applause for Mr. Boss Mustafa, the Secretary to the Government of the Federation, and also our supervisor. Sir, please hold on kindly. We will still need you to unveil the booklet. Hello, sir.
Yes, I can.
Okay, sir. Sir, you can go ahead and do it virtually. I'll give the Director General the honors.
Okay, go ahead.
Thank you, sir. Okay. Yeah. Okay. Sir, you can go ahead.
Okay.
Yeah.
Well, distinguished ladies and gentlemen, on behalf of the President of the Federal Republic of Nigeria, I have the singular honor and pleasure to unveil the booklet, NACA 2007 to 2014, The Journey So Far. This piece of literature will give all the necessary information that any person will want to know about the efforts that have been put in place by the government and by the people of this country with the full support of development partners in our quest to fight the HIV AIDS epidemic. So I commend the book as a source of knowledge and material that will help in projecting the future and being a signpost as to the things that we need to do to get to our destination. Thank you and God bless.
Thank you very much, sir. The Director General will take pictures with members of the I table. Thank you very much, sir. Okay. Without much ado, we call on Mr. Alex Ogudipe, who is the chairman LOC for this occasion, we call vote for him to give the vote of thanks.
Good afternoon. It's my pleasure. This vote of thanks is in two parts. This is the first part, which is to appreciate our boss, Boss Mustafa, who has ably led and opened his door to NACA at all times, has supervised us in a fatherly way. We just want to appreciate you, sir, because as of Friday, he was not in town and we were able to still reach him and he made himself available today, moving all things away. Sir, we are encouraged and motivated by your leadership. We know this is because of the kind of person you are, your background in development. We are pleased to work for you, for Nigeria, and have you as our leader. Thank you. Keep shining, sir, and God bless you.
Thank you very much, sir. With your kind permission, SGF, Mr. Boss Mustafa, we go back to the program. Is that permitted, sir? Can we carry on, sir?
Yeah, you can, but I will take my exit to attend to other exigencies of duty.
Thank you very much, sir. We appreciate you. Thank you.
A wonderful celebration.
Thank you very much, sir.
Thank you. Bye.
Okay, ladies and gentlemen, we go back to the program quickly. We will be calling the Director General, NHRS, Professor Sambo, to give his goodwill message. Are you still online, sir? Okay, we'll move quickly to the NCDC Director General. Are you still online, sir? Is it? Okay, very well. Yes, sir. Sir?
Okay, thanks. No, I wasn't able to unmute myself. The Secretary to the Government of the Federation, if you're still online, Chair of the Senate and House Committees, my brother DG NACA, other Chief Executives, members of staff of NACA, I really join you in celebrating this unique occasion today. For me, it's a bit personal. I remember in the year 2000, when as a young student, just finished my master's in public health, started working, attended the first international conference on AIDS in Durban in South Africa, where I met many of the colleagues on this call, Professor Doko, Professor Ladipo, and where a small group of Nigerians met during that conference to start charting the path of how to work together to initiate a national response. I remember I volunteered to take the minutes of that meeting and shared it with everyone that has attended. So it's really a source of pride for me to see this agency has grown from strength to strength. We refer to NACA as a young agency. NCDC is probably the only other agency in the health sector that is a little bit younger than NACA. So NACA is now older than at least one agency in the health sector. But really, I look forward to working together with all of you. This year has really shown us how the intersections between health emergencies, infectious diseases come together. We could not have achieved the response that we've achieved for COVID without the incredible support from NACA and all the traditional HIV partners, from Global Fund, from PEPFAR. You know, everyone has come together through the coordination of NACA to support the COVID response. And for this, we are not only grateful at NCDC, but grateful nationally. And also we've learned a lot. You know, we've just finished a seroprevalence survey for COVID a few months into the outbreak, really learning from the HIV response and understanding that surveillance is not enough to define the burden of a disease. So my brother DG NACA, I really congratulate you and your team. I know that many people behind the scenes that make things like this and success happen will stand with you every step of the way. And we look forward to working with yourself and other DGs in the health sector to build a much more cohesive, broad health sector response to the threat of infectious diseases in Nigeria. So it's a big day for Nigeria. Congratulations, and look forward to strengthening our relationship. Thank you, sir.
Thank you, Director General NCDC, for your vote of confidence. We thank you. We'll take NHIS Director General, Professor Sambo.
Can you hear me now?
Very well, sir. Please go ahead.
Okay, I want to join the team populace to congratulate NACA for this very good feat. To me personally, I have been associated with NACA. I know the evolution of NACA since when it was before it became an agency. I've been one of the leading consultants in the streaming HIV/AIDS program. I'm very glad to see Hajia Memuna, who has been heading the partnership of that agency since the inception. I'm glad to hear the voice of Alex Ogundike, because we have worked together personally in developing strategic plan for NACA, the first one and the second one. The last sojourn I had with NACA is when I participated in developing investment case that culminated into the NACA trust fund. So I am happy to see NACA has developed to this level today, and this attainment of this great level would have been impossible without the effective leadership of people who have headed NACA, Professor Idoko, very good, and my good friend, Dr. Ali Jambo. So congratulations to all of you. At the level of National Health Insurance Scheme, we are also ready to continue to partner with NACA, so that the organization can attain its common day. Congratulations on this feat, and we are glad to see more and more effort of NACA towards making Nigeria HIV-free society in the near future. Thank you and congratulations.
Thank you very much, Professor Sambo. We call on NEP1. Mr. Abdulkadir, National Coordinator, are you here? Are you there? Okay, please proceed. 1 minute, sir.
So you can listen, you can hear me?
Please go ahead, sir.
Okay. Good morning, everyone. The Director General, it is a happy day for us as people living with HIV. And I want to use this medium to sincerely congratulate NACA and also people living with HIV. NACA is established to coordinate the response of HIV and AIDS and to ensure the well-being of our people. However, this day is making me to remember two things that have happened in the AIDS response in Nigeria. One, it is the NIE survey that is purely coordinated by Dr. Gambo Aliyu, the current DG of NACA, with also a support from the then DG of NACA, Dr. Sani Aliyu. And also the second thing that happened, which is the country alignment. And that is what we want. And I think Nigeria as a nation is taking the way to end HIV and AIDS by controlling all the AIDS response. We can be able to have data that talks about Nigeria. And within this very few time between 2018 to date, you could see even the American government are really showing the result that Nigeria is doing great job. I want to use this opportunity to also acknowledge the support of our development partners, most especially UNAIDS, and PEPFAR and the Global Fund for being with Nigeria and believing in Nigeria. On behalf of the entire management board of NEP1 and constituencies of people living with HIV, the youth wing, women, and the religious body, including key affected population, most especially the group that are marginalized, we have to work towards ensuring that their voice is heard, especially the MSM, female sex workers, and people who use who inject drugs. We cannot achieve it without bringing everybody on board. As we continue to celebrate with NACA, I want to also urge them to embrace more marginalized communities so we can end HIV by the year 2030. Congratulations, congratulations, and God bless you all. Thanks.
Thank you so much, National Coordinator. We call the next to be PEPFAR, Dr. Murphy. Is he online? Okay, he is. Dr. Murphy, please go ahead. Your goodwill message in 1 minute, please.
Good morning, everyone. Thank you for finally coming to me. I was wondering how I was going to go back and tell my bosses that we were at the meeting and we were not called to give a goodwill message. But I think we join everybody here today to celebrate this day and the wonderful achievements of NACA. Our collaboration with NACA as an institution and the individuals is something that we, the PEPFAR country program, are very, very proud of. And as DG has presented, the testament of that collaboration is the fantastic resource and the place that Nigeria now currently occupies in the PEPFAR space as a country that has really overcome all odds, significant challenges, and even the COVID epidemic, and is really on track at the moment to hit our objectives, our goals around epidemic control. So from our sister collaborating agencies, USAID, the US CDC, and the US Department of Defense, and of course, our ambassador, I join all stakeholders today to congratulate the DG and his team for this memorable day. And we really look forward to our ongoing collaboration and really improving on the effort that we have made. We have come so far. There's a lot to applaud. But as we in PEPFAR like to focus on, we like to focus on what is left to be done. And there's still a lot to be done. Others have spoken about it. But beyond all of that, very soon, the conversation that we need to have on how to sustain all of these efforts if the donors are no longer here to be of support. That said, the US government is still solidly behind the government of Nigeria in the HIV response and in all other ways that we collaborate in the health sector. So in that spirit, we are here with you today to say congratulations for coming so far, and we look forward to an even more successful future ahead. Thank you very much.
Thank you very much, Dr. Murphy. Thank you very much, Dr. Murphy. We call on Ashwan, Madam Azomta. Your goodwill message, ma'am. Yeah.
The Director General, I stand on the existing protocol. I want to say that I was there from the beginning when NACA started. I was almost there. And I met two chairmen of NACA when NACA was a committee. And also, I was there when NACA was inaugurated to become an agency. And those days, we do a lot of home-based care that time because of a lot of people living with HIV are coming down with opportunistic infection. So home-based care become one of the major things that the partners we are supporting as at that time. But with the intervention of NACA and also Federal Ministry of Health, the drugs became available. People living with HIV are no longer sick. Opportunistic infection ran away, and people living with HIV are living very healthy with their drugs. Then home-based care disappeared in the system. I want to congratulate NACA we have come a long way. And NACA has actually supported general population for a long time. And the women and girls living with HIV, including young people, are not being carried along, just like the way NACA are supporting general population. And on the word is the DG NACA prioritized that his support will go to more of women and young girls living with HIV. And I believed him. And I hope so that he will be able to support women and girls, especially supporting EID, PMTCT. This is the area I'm looking at that NACA should be able to support and invest on. Congratulations to NACA. We have come a long way. People living with HIV are no longer dying. People living with HIV have access to drug now because of existence of NACA. I want to say that NACA has come a long way. I want to congratulate NACA for this milestone. Thank you very much.
Round of applause for her. All your petitions is being noted. We will take it in the next giant stride that NACA will be taking. We call lastly, before the last person, the honorable you're seated, we'll call on representative of all SACAs, Dr. Okoro, please.
DG NACA and other invited guests, good day, everyone. On behalf of 36 plus 1 SACA, SACA stands for State Agency for the Control of AIDS. I want to join the voices in congratulating NACA for the great achievements they've recorded in the HIV response in the country. NACA leadership has been hinged on the principle of 3 1s. 3 1s, which is 1 coordination, 1 national plan, and 1 national MIE. That has actually galvanized those of us in this sub-national in moving in the same direction with NACA. We are highly, highly appreciated. And we want to say that we are committed in ensuring that in the last mile of this response, which is achieving epidemic control, that we at subnational are ever ready to work with you, with other partners, to ensure that HIV epidemics is being controlled in our country. Congratulations once again. Thank you, sir.
Thank you very much, Dr. Okoro. We call on NASCAP representative. Please, your good women.
Good afternoon, all. Standing on the existing protocol, NASCAP is represented by 2 directors. We bring goodwill message from the national coordinator, Dr. Ikpeazu Akudo, and I will call up, permit me, DG, to call upon Dr. Deborah to give this goodwill message. It's not, I know it's not deliberate to put us last. For every good message we have received today, NASCAP has a part in it. So it's gladdening our heart, and that's why I want to allow Dr. Odo to give the good message. She's as old as NACA.
Thank you very much, Amma.
Thank you, sir. Good afternoon, distinguished ladies and gentlemen. I bring greetings from Dr. Akudo Ikpeazu, the National Coordinator of the National AIDS STI Control Program, Federal Ministry of Health, who is unavoidably absent. She has a meeting with the Honorable Minister. As we all know, the creation of NACA, initially as a committee and then as an agency, is an indication of government's commitment to ensuring that we fight HIV to finish, like we used to say. I remember in the mid-90s, in my clinical years in medical school, HIV then was more or less a death sentence. But now the story has changed. And just like we have all mentioned, we have the introduction of antiretroviral therapy and subsequent scale up to all the nooks and crannies of the country so that people living with HIV can now live healthy and productive lives. The surveys conducted by the Federal Ministry of Health and NACA have indicated that we are indeed on the right course towards ending AIDS by 2030. And we are all glad that this has happened. So today, as the Ministry of Health, we join everyone else in acknowledging the work that NACA has done in ensuring that all the relevant actors play their role in preventing HIV infection and also ensuring that treatment is available. And as the arm of government responsible for overseeing the implementation of the health sector response through the National Treatment and PMTCT program, we look forward to continuing our work with NACA to ensure that we prevent new HIV infections, including prevention of mother-to-child transmission, and the provision of quality treatment for all people living with HIV, children, adolescents, and adults. Congratulations for all the work that has been achieved, and congratulations in advance for what we will accomplish together. Thank you.
A round of applause for Dr. Debbie, representing one of our own, Dr. Akudo Ikpeazu. Thank you very much, Ma. We call on all the representatives. Before I call on the Honorable Chairman of Committee on ATM, I'll call on the all representative of the former directors of NACA. Without their involvement, hard work over the years, NACA will not be recounting or counting on the giant stride NACA has did and the milestone. We call on Dr. Emmanuel Alassane, is the one representing all former directors of NACA. Sir, please, your goodwill message.
Thank you very much indeed, the SGF, although it's no longer online, the Director General, Development Partners. I see Dr. Mora seated. I see my friend Omo seated. Of course, Dr. Okoro and everyone. It's really a pleasure and an honor to be here. It's been a wonderful journey. It's been indeed an excellent one. I would like to say that for all of us that have passed through NACA, and for those that have kept, the flame burning, you are blessed to be here at NACA, or you are blessed to have been part of NACA, because this has been a great place in terms of capacity building, in terms of being a pathfinder, in terms of charting the course in many respects, be it in coordination, monitoring and evaluation, strategy, planning, and all of that. It's been very great. I want to congratulate the current DG for the giant strides in the last 18 months. It's been excellent. I think he and the current team deserve a round of applause. On behalf of the former directors who have worked here, we are in touch, and everyone is doing well because NACA has been a great source of training, a great source of capacity building, is a great source of networking, a great source of knowledge and experience. And we are applying all the experiences that we actually acquired in our years at NACA. I'm fortunate to have been one of those who started with NACA when it was a committee. I recall that Alex, Memuna, and Coyote, 4 of us were actually sitting around one table. Coyote, Alex, I'm sure you remember, at the Federal Secretariat. And then, over the years, it's been a phenomenal growth and a phenomenal number of achievements. Once again, thank you very much for inviting us. We are very proud to have been part of NACA. We are still very proud to be part of NACA. And I say that the future is great. Thank you very much, and God bless you all.
Thank you very much, Dr. Emmanuel Alassane. To round up the program today, we call up the Honorable Chairman Committee. Hello. Okay. ATM, Honorable Atai Rusaki, to give his goodwill message. Okay, that's one more thing.
The Director General and the members of the high table, I brought to you our goodwill message from the National Assembly on behalf of my speaker, in the person of Mr. Femi Bajami Amila, once again, happy birthday at the age of, is it 14? Congratulations. Congratulations. Actually, I think if there is somebody to say one or two things pertaining NACA at 14 from the National Assembly, I think I should be one of them, because I was the Commissioner for Health in National State between 2011, 2012, by then with Professor Idoko, and I knew how NACA is, and I knew how the collaboration between them and states, whereby most of the things he has to collaborate with the state before some certain things will be able to achieve. And I want to really recognize and appreciate the effort of the present Director General and the person of Dr. Gambo, because I knew the type of struggles that we've been doing together, especially him, between the presidency. I know how he struggled. That was between 2020 to make sure that the President of the Federal Republic of Nigeria, in the person of General Muhammadu Buhari, approved the counterpart fundings so that at least NACA should be able to be sustained. And also, I would like to congratulate NACA for the zonal offices that we could be able to have for now, because before we don't have them. Because for now, if we have our drugs on ground, people, most of the centers, they have to go and take their drugs from their zonal offices, not for them to come off to Abuja. We really applaud NACA for that, and we really appreciate them for doing that. And also, pertaining the stopping of the HIV transmission from especially maternity issue of mother to child transmission, of which with NACA today in Nigeria, I'm quite sure is over. And also, I would like to also congratulate NACA in terms of bringing the idea of the HIV Trust Fund, of which is going to be launched very soon. I want to assure you that the National Assembly is behind that, and we are waiting if there is anything that's going to come in terms of the Trust Fund in National Assembly. I was with the Honorable Speaker, and we're ever ready for that. We're not going to wait for a second to find that out from the Trust Fund. And also, I want to congratulate NACA because it's because of the correct data for the strategic HIV/AIDS intervention that today, even from the United Nations also, they could be able to achieve one or two of our achievements in the world. I would also like to use this opportunity to appreciate the efforts of the donors of the type of collaboration they have been bringing to this country to see the end of the HIV and AIDS. And one of the things that I want to say pertaining the issue of convicts, of which we, the National Assembly, were doing our best. When this issue of convicts started, that was in 2020, we are aware of what the staff of NACA has been collaborating with NCDC. Our laboratories, those are where they normally use for all these tests, whatever, even before the federal government to be able to come with some certain fundings. But the last meeting we hold, there was some certain money that was being shared to teaching hospitals, and then also some of the research centers, of which I made the speaker and I informed him that to our greatest surprise, NACA is not there. And he promised us this 2021, by the grace of God, all the funds being allocated for convicts, NACA is going to be included in certain, most of the laboratories. Without wasting your time, I would like to wish you well, and on behalf of the National Assembly, once again, I would like to say congratulations. Thank you and God bless you.
Please, a round of applause once again for Honorable Atayu. You can see why we left him to be the last to make the goodwill. He has assured of more funding. And I'm glad my Director General is smiling because he knows who to hold for more funding. Thank you so much for that. And thank you for the assurance that we will knock on your door and receive more funding by National Assembly. Take a round of applause for him again. Now we have come to the end of the program, and I will be handing over the mic to Mr. Alex Ogundipe, who is the chairman LOC for this auspicious occasion. We will first comment and say they have put together a fantastic job. Within the space of time, we have this. So we will congratulate on behalf of the agency, the LOC as well, that they've done a fantastic job in putting this together. A round of applause for the LOC, please. I call on Mr. Alex Ogundipe. I call him the Don, so please take the honor. Thank you.
Thank you very much. The Director General, the distinguished guests on the high table. I have the most simplest of tasks, particularly when you've got very qualified hands, very technical hands, very capable people working with you. You can pull through anything. I think it was about this time last week that we got the marching order that this must be a success. And some people have not slept for 3-4 days continuously. It's amazing all that everyone has put into this. I know how busy some of the important personalities are, and I'm amazed that they found time to shift things and prioritize this. I want to appreciate you all. So on behalf of NACA, on behalf of the committees, and on behalf of the Director General, let me put on record that we would like to appreciate everyone. This is not about NACA that achieved all of this. NACA just facilitated. NACA just brought people together. So many people that we cannot mention, that we don't remember their names. Some have died, some are alive. They are the ones that are responsible for all these fantastic results that we are showing today. This journey started since 1986, when the first case was discovered. Many people sacrificed to get us to where we are in 2021. On behalf of all of us here, can we appreciate everyone that has contributed anything to this response from Dental with a show, with a clap offering? Thank you. So I will continue by also appreciating the Nigerian government for providing the enabling environment, for providing all the support that has got us here. I'd like to appreciate all the agencies of government that has collaborated with us thus far. I'd like to appreciate all the donors, development partners. I can't mention them individually because I might omit any one of them. But most importantly, I also like to thank the leadership of the National Assembly. If the National Assembly hadn't done its job, that committee of that NACA would have been obliterated. So we'd like to appreciate the National Assembly for what you did then and for continuously ensuring that we are funded and we are not grounded, and for your understanding of the issues at stake. But ladies and gentlemen, there's a group of people you need to appreciate today. Without them, we won't be here. There was a time in this country that HIV was death sentence and people were dying in droves. A lot of lives were lost. We really need to appreciate them, those that died, and those that came out. Without their coming out, we won't be where we are. I respectfully ask that we all rise up for a minute silence for all those. In fact, even during the 90s, there were people who were running on the sidelines that also lost their, so many people have lost their life in this response, not to HIV alone, but even to the cause of HIV. So can we observe just 1 minute silence on behalf of all of those? May the soul of the departed rest in peace.
Amen.
Please be seated. So finally, I would like to appreciate my committee members that worked tirelessly through the weekend. Some of them have swollen eyes right now. Some of them applied their resources. I want to appreciate you for what you have done. Please, can you give them a round of applause? I would like to end this by apologizing for any shortfall that you have seen. It could have been better. The fault of whatever gap you have noticed in this committee, in this output, is not NACA's. It's my fault. That means I failed in my leadership. I didn't complete the task. So I take all the blame for whatever gap you noticed in this program. Oh, we could have done this, we could have done that. It's my fault. I should have pointed it out and made it happen. But for all the successes, please, let's put a round of applause for all of us that are present here and the DG. Thank you very much. Thank you so very much. So the last word of appreciation is coming from the board chairman who is online right now. Over to you, sir.
Thank you very much, Alex. The Secretary of Government, Mr. Boss Mustafa, DG, NACA, and all our very distinguished guests. Once again, I want to thank you for finding time to be with us today. I also want to congratulate again the management and staff of NACA for this excellent presentation. Alex said there were some shortcomings I didn't notice, but I'm sure 2022 NACA Day will be even better. And we pray that we all be alive to witness the 15th NACA Day. Thank you very much. God bless you. Keep safe. Wear your mask. Good afternoon and bye-bye.
I saw Senator Utazi later and they are showing, but I've been asking why is Utazi? Okay. Yeah, they couldn't figure it out. Maybe it's in your, okay, yeah. But I was looking for him at the beginning. I asked them, yeah, Utazi. They didn't see him, I think. But it's good that he was there. Yes, yes. We should have recognized him and give him exactly. Yeah. Thank you. That's